the kitchen sink.
Yeah, well, you know, I'm going to do it for a second and get lighter from him. I can't even find him.
Then you just have to wait.
Well, 3 days they're going to let me go probably today. A few minor complications, nothing really. I just couldn't pee. And I was very nauseous the first 2 days after the surgery. Couldn't eat really. The first day I couldn't do the physical therapy because I was throwing up. But other than that, I got a new hip. Your hip joint is a socket joint where your thigh bone connects with your pelvis. Surrounded by cartilage, muscles, and ligaments, it is one of the largest weight-bearing joints in the body. Smooth cartilage and bone help you walk easily and without pain. In a problem hip, the cartilage and cushion wears away and the bones rub together, becoming rough and pitted. The ball grinds into the socket when you walk, causing pain and stiffness. With a total hip replacement, also known as total hip arthroplasty, the surgeon removes the damaged bone and replaces it with a complete prosthetic joint. Preparing your home for post-surgery recovery. Before surgery, assess your home for personal safety and recovery. Stock up on some food and other necessities that you'll need. Remove throw rugs, extension cords, and anything that may cause a tripping hazard. Install some night lights in dark rooms and hallways. Make sure your walkways are clean, free of clutter, and can accommodate the width of a walker. Install grab rails in all bathrooms you intend to use. You may need to purchase a raised toilet seat, a shower chair, and other items that will make your recovery easier. Prepare and organize your bathrooms with everything within reach. Make sure you have clean towels ready that you and only you will be using. Follow your doctor's recommendations before surgery and have everything you need beforehand. Before surgery, you may need to have a screening for Staphylococcus aureus. The night before surgery, take a chlorhexidine shower. The morning of the surgery, take another chlorhexidine shower. Do not use any lotions, powders, ointments, or deodorants after the 2 showers. The day of surgery. Check into the hospital. You'll be changed into a gown and have an IV started. Your doctor and anesthesiologist will meet with you and go over everything that will happen before and during surgery. Your surgeon will initial the surgery site on the operative leg. Pre-surgery medication may make your mind fuzzy. If you become anxious, and it's perfectly natural to be, let your nurse know. They can give you something to help relieve the anxiety. When the surgery is complete, you'll be taken to the recovery unit. You will be monitored until you wake up from the anesthesia. The nurse will ask you several questions and ask you to wiggle your toes several times before you regain that feeling and movement in your leg. A physical therapist will get you up and walking within 4 hours or so after leaving the recovery room. In my case, I was really sick from the anesthesia that I could only get up and walk to the chair and sit for a few minutes. You will have goals required to meet before being released from the hospital. It is usually that you can walk 100 feet safely and climb a flight of stairs. Your physical therapist will assist you in getting back to safely walking very early in your recovery. You may also have a compression sleeve while you stay in the hospital. It will improve your circulation and help prevent blood clots. Precautions for total hip replacement. There is a risk of dislocating your hip replacement after surgery, so it is very important that you follow these few rules. It is very important that you do not cross your legs or ankles. Do not turn your operated leg inward. Do not turn or twist your body without moving your feet. Do not bend your hip forward past 90 degrees. With these things in mind, you should have a successful surgery and an equally successful recovery.